Hi, my name is Carly Auer, and I'm a classical homeopath at Our Family Homeopathy in Mesa, Arizona. I have two children who have been raised on homeopathic medicine. Homeopathy has been such a gift in our lives, and I'm so happy today to be here to share it with you. I'm a graduate of the American Medical College of Homeopathy in Phoenix, Arizona, and on behalf of AMCH, we would like to welcome you to our new self-help homeopathy program. I invite you to visit us at selfhelphomeopathy.com. We have 30 different programs in a variety of topics, from acute back pain to cold and flu to autism spectrum disorders. The great thing about these programs is that in addition to focusing on a specific ailment, they also offer an introduction to general homeopathic and holistic medicine. So if you've ever wanted to learn about homeopathy and how it can help you, this is a great place to start. Visit us at selfhelphomeopathy.com.
Here is a brief clip from this program suggesting homeopathic remedies that are useful in treating this condition. Just to say a few words about the two remedies that I already mentioned, and I'll be talking about them more specifically when we get to various conditions. But the first is Caulophyllum, electroides, or blue cohosh, or squaw root. It has many uses during pregnancy, but perhaps most well known is for women who are having difficulty initiating labor, where they have uterine contractions that are not very cohesive and somewhat random. And so the cervix is not dilating despite the contractions, and the contractions are kind of flitting around without any organized a contraction. So it's useful for labors that get stuck in the early stage. It has been also used for women who've had difficulty with labor prophylactically, both herbally and as a homeopathic remedy to help prevent or make labor go through more smoothly or easily by using it prophylactically. Typically, one of the problems with Caulophyllum is that there is a feeling of muscular weakness and exhaustion. The woman feels too weak, too tired to be able to go through labor. There also can be a feeling of trembling, both externally and internally, and nervous excitement. There can be a lot of arthritic pains associated with this remedy, particularly in the fingers and in the toes. There also can be profuse vaginal discharge during the pregnancy associated with this remedy, and it can be an indication that this is a remedy that is needed. Pains typically are more neuralgic in nature, more sharp and shooting, and can occur anywhere in the body. Also, as we'll talk about a little later, it's a wonderful remedy for women who have repeated miscarriages, or who retain their placenta after delivery, or who have excessive bleeding after delivery. And probably the main homeopathic remedy to confuse with this remedy is Gelsemium sempervirens, which also has a lot of weakness and trembling associated with it. The other specific remedy that I want to mention that relates to pregnancy is Cimicifuga racemosa, or black cohosh, or snake root. It's a plant that comes from the woodlands of North America and has been used historically for hundreds and hundreds of years by women using herbal medicines to treat hormonal problems associated with menses and pregnancy. Like Caulophyllum, Cimicifuga is very specifically useful for women who are having difficulty with their labor. Rather than weakness as being the primary manifestation, there is a lot of spasms that don't seem to be well coordinated. The spasms are brief, but not moving towards delivery. The pains also are fairly sharp and neuralgic in nature. There is, However, with Cimicifuga, a very strong emotional component that goes with this remedy. Typically, it is a feeling of hysteria or changeability, where the mood will go from one feeling to the next relatively quickly. There can be a great deal of depression associated with the pregnancy, gloominess, moroseness, and pessimism. There's also a lot of sighing that is associated with their depression. They'll often describe the depression as the feeling of a black cloud descending on top of them and a feeling of being trapped. It's a very useful remedy for women who have terrifying memories of previous miscarriages or births. And there can be physical symptoms that alternate back and forth with emotional symptoms for women who need Cimicifuga. Oftentimes, a lot of problems with the back of the neck. There can be headaches that originate from the back of the neck, and also stiffness in that area. It tends to be a very chilly remedy and a useful remedy for excessive bleeding, particularly after delivery. Also, this is another remedy that can have a tendency towards miscarriages and can be used to prevent miscarriages when given. Also, it's probably our main remedy for women who tend to develop postpartum blues and postpartum depression. And the main remedy that is often compared with and confused with is Ignatia amara.